So I'm Dana, I'm a physical therapist here at the hospital, and I'm primarily in, well, inpatient and outpatient settings. So a brain injury is what results after an event that causes damage to your brain's tissue. More specifically, affecting the physical integrity of your brain and also the metabolic activity in your brain, which ultimately can cause damage to the nerve cells and its ability to communicate with each other in your brain, limiting your physical ability, like your body's ability to function. So there are two types. There's traumatic brain injury, like hitting your head in a car accident or a sporting injury, you know, we hear about football, or falling off your bike, so an actual thing happening to your head. Or a non-traumatic brain injury, so a stroke is still a brain injury. There's damage, physical damage to your brain. And then also a hypoxic event. So something that can happen when you don't breathe very well and you're not getting oxygenation to your brain. Your brain needs oxygen, and that can cause damage, again, to your brain. So when you get a concussion, think a bruise to your brain. So a concussion is a really quick, rapid acceleration and deceleration of your brain in the hard case of your head. So you can get a bruise, damage to the front of your head and the back of your head, even though, let's say, you only hit one side, or right, left. So think of a significant bruise in your brain when you hit your head and you end up with a concussion. So they can range in severity and presentation, of course, but some things that you want to keep an eye out for: change in consciousness, having a hard time thinking straight, forming words, if you feel nauseous or actually vomiting, very, very serious. Severe headache, disoriented, you're not sure where you are or what's going on, you can't really make sense of what's happening right now. And of course, speaking, swallowing, moving your arms, your legs, anything like that. Again, range in severity, but those are some symptoms to keep in mind. This area is rife with potential. So yes, skiing for sure, rock climbing, bouldering, mountain biking, and horseback riding. Horseback riding is for real. And sporting events. There's lots of things that we do around here that have a high potential for brain injuries. Helmets. Helmets, helmets, helmets. And then don't feel like you have to prove anything. Don't take that black diamond if you're not feeling comfortable, or make that move on that route that you just feel like is a little bit too far out of your comfort zone. And helmets. Please wear a helmet. So depends, again, on the severity. It can take hours, depending on, you just kind of cracked your head on something, you turned a corner too fast and didn't see something. It can just kind of give you a little bit of a headache for a little while, to, again, really did a number on yourself, and you could have persisting symptoms, difficulty thinking clearly, maybe even for days. So it was previously recommended that individuals who have a concussion or sustained a concussion shouldn't sleep to ensure that the symptoms didn't worsen. Recommendations now have changed to somebody watching over the person with the concussion and waking them every so often to check orientation, speech, quality, any difficulty, again, with sensation and movement, motor control. It is common that people who have had a brain injury, again, traumatic or non-traumatic, that'll make you very tired. Your brain is an energy expensive part of our bodies, and when there's damage, it wants to heal itself and can cause a lot of fatigue. So it's common to be very sleepy, but it's important when something's new to be woken every so often to ensure that there isn't any progressing symptoms. You bring yourself to the hospital, you end up in the ED. Your physician will go over your symptoms, any reports that you have. If a family member or a friend or somebody who was there has any information to offer, again, depending on the severity, they're gonna want to take a full review of all of that. And then, of course, imaging. Your physician will determine if you'll need a CT versus an MRI versus even an X-ray, depending on what kind of accident you were in, what kind of situation happened. And from there, depending on your presentation and their findings, they're going to recommend either seeing a specialist or any medication that you might need. If it's an older situation, say you didn't come in and something's not changing, your physician might go through all of those diagnostic tools and then maybe even refer you out to rehab, because your brain is very plastic and moldable, so to speak, and so a lot of retraining is possible. It is very real that if you don't use it, you lose it, and your brain wants to work. Your brain and your body like to work together, so it is possible to reroute and remap some things and learn to do things differently. So again, depending, say you had a stroke, there's a lot of potential for recovery after a stroke. If you come see us early enough, for sure, lots of potential for brain remapping and shaping. So in the event of anything happening, or you suspect that you have any problems or you're not sure what's going on, please call the number on this screen. They can definitely direct you to the services that you need. Get in contact with a provider. Again, the number will be available to you and you can get a hold of anybody to answer any questions immediately. But again, you don't want to wait to get the care that you might need. Thanks for taking the time to listen to this video and learn a little bit more about traumatic brain injuries and concussions. Thanks for choosing Northern Inyo Healthcare District.